We're opening season 3 with another deep dive into gender affirming care, but this time focusing on its expansion and diversity as it applies to groups across the country. There are a few options one may consider when reaching out to a medical provider or facility regarding care. How affirming and well trained are the staff regarding pronouns? Do they have multiple types of services related to medical, clinical, and/or psychiatric care? How welcoming is the environment to trans and gender non-binary people overall? Recently, there's been a shift in the offering of certain services like gender-affirming hormone therapy and PrEP, prophylaxis against HIV, from being solely offered in an in-person clinical environment to being made available online. These days, a queer person who does not utilize healthcare that much, either because of access, cost, or medical mistrust, has the option of initiating these services via telehealth and then getting mailed their medication. And how does this impact health equity for LGBTQ plus people? Well, in the case of queer people living in rural areas or are not currently out to their friends or family, this method allows them even more privacy to receive the care they need. This can reduce the feelings of anxiety and distress associated with scheduling an in-person healthcare appointment with regular follow-up, leading to improved mental health for some individuals. In addition, many of these telehealth offerings provide this care without the need for insurance and affordable prices. This also may be desirable. Listen in with me as I have a lovely conversation with Dr. Jerrica Kirkley, CMO of Plume Health, where we will discuss all things about gender-affirming care, including how the term's interpretation is pretty flexible and how Plume Health is providing this important care for numerous people. Hello, everyone. Welcome to season 3 of the Equity Podcast. Today is an amazing day because we are starting off our first episode talking about gender affirming care. And today we have Dr. Jerrica Kirkley with us. Welcome.
Thank you, Renee. It's so good to be here. Thank you for having me.
Of course, of course. So Dr. Jerrica Kirkley, pronoun she, her, is co-founder and chief medical officer at Plume Health, a leading virtual care provider dedicated to the trans and gender diverse community. And a little bit on Plume Health, it is one of the largest virtual providers exclusively focused on serving the trans and gender diverse community in the United States. Plume has helped more than 40,000 trans and gender nonconforming patients, that's a lot of people, access life-saving gender-affirming care. The majority of the staff is trans, about 60%, and even more identify as part of the LGBTQIA+ community, with deep experience and expertise serving the TGNC community. Dr. Kirkley completed medical school at the University of North Carolina at Chapel Hill and her family medicine residency at the University of Colorado. She has taught widely on gender-affirming care across academic institutions and large clinic systems. Dr. Kirkley has cared for thousands of gender-diverse individuals and has also been a recipient of gender-affirming care as a patient and trans woman herself. Her mission is to transform healthcare for all to make it more accessible, affordable, and align with the needs of the individual to help folks live happy and healthy lives. And I can't be mad at that. So thank you so much for all you do. And again, welcome to the podcast.
Yeah, thank you, Renee. Well, that was a very, very warm intro. Thank you. Yeah, again, happy to be here. I'm looking forward to this conversation.
Amazing. So I want to start with some background before we get into more specifics about Plume and just general about the world and the state of the world that we're in. So first, who or what has inspired you to pursue a career towards shaping health equity and or social justice, or however you would like to call it?
Yeah, that's a great question. I first thought about going into healthcare when I was in high school. And I think that really came from this background of participating in community service. And so I didn't really know what I wanted to do, but I wanted to have some kind of career that was service oriented. And working in healthcare, whether it be a nurse or a physician, did come to mind. My mom is a nurse, and so she worked for a long time. So I had a little bit of connection to healthcare, but that was about it on the personal level. So it was pretty nebulous at that point. But I was just like, service oriented career. And then started to look into, being a physician a bit more towards the end of high school. And I was like, okay, I'll start to explore what that looks like in undergrad. But in terms of the inspirations, gosh, I mean, so many people. I think just being in college, that was a moment where I really opened my eyes up to a lot of things, but I think
Hmm.
especially the social justice space. And so
Hmm.
certainly like very close friends who I am friends with to this day and I consider my best friends. And of course, I've had professors along
Great.
the way who also serve as an inspiration. So a lot of it was just like understanding what is going on outside of my little bubble that I grew up in North Carolina, in
Hmm.
a Southern Baptist family. And so really starting to just broaden my horizons for what's out there. But a lot of that led me in college to, more deeply understand like the gaps in healthcare. I certainly did a
Mm.
lot of volunteering in my local community.
Yep.
And, North Carolina, we have a large immigrant population, a lot of folks from Mexico, Guatemala, other parts of Central America.
Yep.
And so I worked in a lot of clinics that were serving that population and then ended up being able to travel around actually to a lot of Central and South America during college. And so saw in other health systems outside of the US the gaps that were occurring in healthcare. So I think that's what really
Yeah.
brought it all together for me to say, like, yeah, I definitely want to do this. I can see how medicine can be a vehicle for social justice. And then that led me going to medical school.
Oh my gosh. Wow. Wow, 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 wow. Hablas un poquito de español.
Sí, hablo español. Sí.
That's amazing. Qué bueno. That's great. I speak Spanish too.
Oh, no way.
So I mean, that's awesome that your path, right, kind of was high school to college and then learning more about like what are the gaps in healthcare. I think that's really what stuck out to me, right?
Right.
Because obviously, like everyone has different reasons for going in, but I'm sure
Mhm.
during your time, right, you saw a lot of particular scenarios of people like needing certain healthcare needs and not getting them met per se if there like aren't enough resources or if the training for providers isn't there. And so
Mhm.
I think that's really great because what Plume is doing, right, is it's offering gender affirming care to people of so many diverse backgrounds, whether you can afford it or not, trying to break those barriers.
For sure.
Exactly. So I can definitely see like where you're coming from with that.
Yeah, yeah. I mean, I want to kind of highlight a couple moments that I think were particularly pivotal. You talk about the moments of inspiration.
Mm-hmm.
You're in
Go ahead.
medical school now. I remember when I was going through medical school, there was definitely not like the level of gender affirming care education that there is, or even representation. Right? And so,
Definitely.
I mean, I wasn't out at that point, but I do remember there's a study that came out back around 2011. It was like, well, the median time dedicated to LGBTQ plus care in medical schools is about 5 hours,
Mm.
right? Over a 4 year curriculum.
Wow.
It's kind of crazy. And I think it's evolved. I do think
Wow.
there are schools who are doing a better job. But even within that,
Yeah.
usually trans care was absent completely. Right. And
Mhm.
so that's always like the last piece to get worked on. So we had this like optional LGBTQ plus health day, right? It was one half day. It was optional. That was the entirety in the curriculum of the medical school.
Yeah.
But we had a lecturer come in who is trans woman, and she like started a private practice, and I think this is like my little trans baby self hadn't come out yet, but there was something clicking there even at that moment. I was like, whoa,
Yeah.
this is amazing. And then I had a really awesome mentor in my residency who wanted to build out an LGBTQ plus curriculum for the resident. And that's where I really started to work on gender affirming care, specifically with hormone therapy and teaching other residents and faculty how to provide that care. And so that kind of catapulted me to my career of like, well, yeah, like this is amazing being a part of this with patients. There is a clear gap in care here. So
Yes.
that was a part of it. And I want to dedicate my career to doing this in some way. So yeah, but I think that representation
Yeah.
is so important. And even though it wasn't a lot, there was a little piece there in medical school that like I still remember to this day. That was, really meaningful.
Yeah. The representation aspect, like you said, having another trans person come into the school and talk about like, oh yeah, like I've made a career out of helping people, right? In like a situation maybe they were in and they saw like they needed help too and like just passing it on in that way. And I think that's so important, right? Is like seeing other people do the work. And to your point about like that being inspirational. And then it sounds like you had that teaching background too. So that's really awesome. I've heard in certain places in the country, certain students are still teaching their faculty even or like other students about what is gender affirming care, like, and what can it include, and sort of like the mechanisms of it. How does it work, and everything, and like the timeline. And so I really do hope that in the future we do see more increases in that, and the learning is better, because we obviously want patients to feel comfortable with providers who are knowledgeable about what that is. You often hear a lot of times, right, that trans people may go into a clinic and may not feel heard or understood because the doctor or the provider might say, I'm not familiar with that.
Hmm.
But there's someone else that you might go to, but that someone else, right, may not be even like in their area or where they live, or something like that. And so there's a lot to consider.
Hmm.
So you talked about significant gaps that you saw. I wanted to mention a little bit about family medicine. And the reason is because I'm also interested in family medicine.
Hmm.
So what do you think about the specialty that you chose has helped you pursue your goals?
Yeah, I love talking about family medicine. I did do a family medicine residency, so I have a little bit of a bias, but getting
Yeah.
even back to that inspiration moment of what drew me to healthcare and looking at, social injustices and thinking about medicine as a vehicle for social justice, family
Mm,
medicine stood out as I was going through and thinking about what do I want to do. And what I saw was the involvement of family medicine in various movements throughout time, especially in the 20th century. And so the civil rights movement and the formation of community health centers that came directly out of that movement.
mm-hmm,
Um, we saw, of course, the AIDS epidemic and
mm-hmm,
nurses who were coming together and caring for queer patients who nobody else wanted to care for. And then those kind of led to community health centers, which were largely staffed by family physicians and nurse practitioners. And so there's just always this presence there that I thought was really neat. And of course, having a broad range of skills and where you can care, the goal is to care for almost anybody at any given time, anywhere you
right.
are. And that was the point of the specialty, was to help meet these access gaps that were occurring.
Mm-hmm.
So all that put together, I was like, well, because I was debating, do I do pediatrics? Do I do family medicine? I was into
Yeah.
surgical stuff, and family medicine was the sweet spot where I could kind of do all that, right? Like
Mm-hmm.
you can care for pediatrics. Of course, you do adult care. You can do pregnancy care if you want to. There's a lot of procedures, some minor surgeries. So those were the things that drew me into family medicine.
That's wonderful. And I am getting so much out of this from what you're saying, because I'm also considering family med. So what you
Okay.
said with all those reasons makes so much sense. I think primary care providers tend to be like the first people to kind of be the
Mm.
gate entry into care, and like understanding somebody's entire background, right? And like collecting like the entire history, and like understanding what exactly do they need from there, and like how you can sort of be the bridge between the patient, specialists, and other organizations or other people who are involved. So I think that it makes total sense that you did that. And I
Mm.
am so happy that it's been working out.
Yeah,
Yeah.
me too.
Yeah, no, because I mean, it is match day. So I'm thinking of like the students who are matching into specialties, and, it
Yep.
can be sort of like, I mean, that's just particular for medicine and other fields, but
Yeah.
it sounds really great. And so thank you
Mhm.
for sharing that a little bit. I wanted
Absolutely.
to now go into Plume Health.
Okay.
So, again, Plume Health is a virtual gender affirming care clinic and a trusted source of community, wellness, resources, and support for the trans and gender nonconforming community. So, as we know, gender affirming care is life saving. Multiple studies show the mental health benefits of starting hormones for individuals experiencing gender incongruence or dysphoria. As this care is highly sought after, there do exist a few barriers that may prevent people from being able to access it. We've discussed a little bit about affordability, physical proximity to a clinic. There's also age considerations and or government regulations to be considered. So I'm curious, because I'm sure you've collected feedback over the time since Plume has started. What barriers does Plume have the ability to help patients overcome, and which ones remain challenging? And either if that's from feedback, that would be helpful to know, or from what you would say as a leader there.
Yeah, I love that question. And I'd probably start by going back to the beginning of Plume and almost
Mm-hmm.
matching where we left off the conversation of medical school and residency. And so after residency, I went and worked at a federally qualified health center, and there, kept practicing seeing trans folks and was doing broad primary care, but really continuing that mission of teaching, getting other providers involved in it, teaching other health systems, and both a pretty large panel of patients for a primary care setting. But in that setting, getting to the barriers, what I was seeing was like we were a safety net. It is a safety net setting,
Mhm.
right? They take a lot of uninsured folks, a lot of folks on Medicaid. But even in that setting, one, it was hard to get to because just physically, Colorado is a big state.
Yeah.
And it was hard for people to get to this, clinic that I was in outside of Denver. But also there was cost issues, even though it's a community health center and it's a safety net setting. A lot of people fall into this gap of not qualifying for sliding scale, based on income, but also not having access to health insurance. So they're left in this middle gap, and a lot of people are there. And that resulted in like doing a visit and a lab for $700 and $900, right? Even at a community health
Wow.
center. Single visit, single set of labs. So cost is definitely a barrier for folks. And then there's competency. So even in that place where I was working, I had
Mm.
been doing this a while, teaching on it a while, teaching even in that community health center. It's hard if that's not the main thing that health center is doing. And so
Mhm.
inevitably there can still be challenges because of walking into any physical setting. Like, does it really fully feel safe and welcoming and affirming? But that's always a challenge, is trying to get competency across not only individuals but physical spaces.
Exactly.
And so those were some of the things that we were seeing, that I was seeing very personally. And that's what Plume was born out of. Was like, okay, how do we create a care environment
Mhm.
that chip away at those things? So we wanted to build a space that was virtual. That was very intentional from the beginning, is do fully virtual care,
Mm.
knowing now this was pre-COVID, right? So we didn't even have that as,
Really? Yeah, it was about 2019, right?
yeah, it was 2019. We actually started first thinking about it early, like
Yeah.
February of 2019, and then we piloted it towards the end, like towards the summer and fall. So it was well before that. But even, COVID notwithstanding, we knew that virtual access was important for
Yeah.
safety, and then just for like physical access to, transcend geographic distances. And one of the most pivotal things that we found with doing this virtually, while acknowledging that, everybody has different preferences when it comes to care. Some people like in person, some people like virtual. We found that for many people, like virtual has been helpful for, even like different styles of communicating, and whether that has to do with like neurodivergence, just different personality styles. Like sometimes in-person communication can be really challenging. And so that
Mhm.
like virtual audio video communication just gives people some different options of how they can show up, and have acknowledged that that's been helpful for them.
Yeah.
Um, Now, and then there's just even outside the care, which can be preference based, being able to build a care team that provides virtual care has been really important. Now, we intentionally scaled across the United States. We're in 48 states. But the fact that we're virtual and we're remote and we're completely distributed in different locations, we can recruit our providers, our care teams,
Mhm.
everybody in the organization, from operations to our technology teams, from anywhere, right? And so if you can
Mhm.
only recruit in a single geographic setting as a clinic, just by the nature of how trans folks are distributed, you're not going to be able to hire probably that many trans people. And on top
Yeah.
of that, like not many people are clued in on like how to hire trans people and what communities would be for and
Yeah.
how. So yeah, that's how we've been able to build an organization that, as you mentioned at the top, over half the organization is trans, the
Yeah.
majority are LGBTQI plus identified. So that's been really cool too. And that gets to that ethos of like providing care that is informed by the lived experience of those that you're serving, right?
Yes, yes. So many gems in what you said, and I like how your responses are like starting with your timeline, because with the timeline it's like you went from college to medical school to like working residency, and like to talk about the federally qualified health centers, those federally qualified health centers are given money to support patients who normally could not afford typical
Right.
care, or maybe underinsured or uninsured. And when you mentioned the sliding scale, I think that's interesting because the sliding scale of payment, right, is an example of how the governments are trying to set a certain window of money that you can make to qualify for care.
Mm-hmm.
Whereas what I'm understanding from Plume is there really isn't the same sort of concept. There are plans for either if you have insurance or if you don't, but I think it's like a little bit more flexible from what I'm hearing.
In terms of that plume and
Yeah.
yeah,
Right, right. And like
yeah,
affordability in that sense. And that's just one example
yeah.
of like the flexibility. Cause then there's also being able to join an appointment, I assume from your phone. You could probably
Mhm.
like do a
Yeah.
telehealth appointment, right? And like being at home. And that is different, right? Because somebody might feel more comfortable, right? A person who is neurodivergent or simply is disabled or something like that, or
Mhm.
is not able to go out as easily, right? Can
Right.
have the opportunity to still have great health care and have a conversation with the provider, but not necessarily go to a clinic, because sometimes those clinics can be not as inviting and may not have, again,
Oh,
like the support there. So I definitely see those two bits that you were saying about how like those barriers can be overcome in a way. So for me, the word flexibility just comes up in my mind because it's sort of offering people more opportunities to engage in care for them that otherwise would be difficult to engage in.
right. Yeah, yeah, for sure. And we started at a kind of a very simple, transparent model where it was like a cash only membership. We still have that today, but we have tried to add on those other options. And that cash membership in and of itself, yeah, it can be affordable for many, but obviously not for all. And healthcare, unfortunately, is really expensive. It's expensive to do and to
Yeah.
to provide. But we have started accepting health insurance as well, and we've done that for like the past couple of years. So increasingly, we have more and more contracts.
Yeah.
Yeah, so folks can use their health insurance and get the care reimbursed. And then we also have a payment assistance program that we've partnered with a cool nonprofit called Point of Pride. And they've been
Okay.
around for a while, but we started a assistance program for hormone therapy specifically, where we raise money through that nonprofit and they can help pay for up to a full year of care for folks and also help connect to like social organizations and hopefully get folks on their feet to where they can continue that care.
That's awesome. So there's like three ways in itself where like you can afford it or think about payment in some way. And so I like how like there were additional options added on as like the company has grown, it sounds like.
Yeah.
So that's really amazing. One aspect of Plume that caught my attention was the sentence on the website, gender affirming care beyond hormones.
Mm,
Many people may think gender affirming care is mainly based in medication and or
mm,
surgical services, but it also can encompass the provision of services that understand the specific needs of TGNB, transgender non-binary people. Some of these services offered include mental health support, smoking cessation, and sexual health services. Is that correct?
yeah, that's right. Yeah. So we do offer those as well. Yeah. And
Yeah. No, go on. Which of these
okay.
services, I
Yeah, yeah.
suppose, yeah, are like the most popular or like that you see used the most?
Mhm. Yeah, no, and I love the prompting of just kind of breaking down what do we mean when we say gender affirming care. As you said, it definitely carries oftentimes a specific definition or label of hormones and surgery, and that certainly is can be a part of it for many people, but
Hmm.
obviously not for all. And
Yeah.
there's so much more to it. And I think you phrased it really well. I think about it similarly. Like gender affirming care is any care that's informed by the lived experience of trans people, right? And so that could
Period.
be nicotine
Right.
cessation, that could be legal support, that could be social support, helping somebody find housing.
Hmm.
It could be any of these things. And so at Plume, we're trying to get into as much of that as we can and really provide that comprehensive care model, focusing on like the highest needs areas. And so, yeah, you mentioned a couple there on the more clinical and prescribing side. And I'd say, mental health is certainly one that comes up a lot. We know that the trans community is
Yeah.
disproportionately impacted by things like depression and anxiety, and it can be hard to find providers. So that one, definitely we've seen a lot of people through that. Now, even outside of the clinical stuff, we also have a whole host of services that we call our community and wellness services. And so these are the
Hmm.
things that are not actually provided by clinicians or by prescribers. And this could be
Right.
peer support. That's one of the big things that we've developed over the past few years is
Your
having virtual
support.
peer support groups. We've recently launched in the past year what we call our community hub. And so this is an interactive space where all of our patients can actually interact with each other in a moderated forum. And so they can share their stories, they can share resources. We can provide, of course, resources to folks and have different groups. So that's been a really cool thing where we've seen a lot of engagement with. And also do a lot of webinars and educational content that's both written and through
Hmm.
events. And then a lot of legal and social support. So things like if you're trying to change your legal name or change your gender marker on various
Hmm.
documents. And then, the piece we've gotten into a lot in the past couple of years by necessity is advocacy, right? Education and advocacy, because we know we've seen so many anti-trans pieces of legislation and now with
Yeah.
the new administration and the executive orders and everything they're trying to do creates a lot of confusion and chaos. And so we're certainly trying to be like a megaphone for like, what is the truth? What is the reality? But also done quite a bit of just like overt advocacy of lobbying or going to Capitol Hill or posting public comment on rules and things like that. Um, so that's been a piece that maybe we didn't totally anticipate being as deeply involved as we have, but it's been a really cool part of the process as well.
Interesting. Yeah, I think it kind of goes beyond just the medical model in a sense, right? Like
Mhm.
provision of a medication or a service, procedure, etc., and then that's it. Like it goes beyond that. It really does touch many factors that intersect in a trans person's life, and even like peer support, for example,
Mhm.
offering the opportunity for someone to talk to somebody who's probably similar to their background or has gone through the same thing they've gone through, but not necessarily having to talk to a provider or, again, have to give so much information, right, in a setting with somebody new that they don't want to. It's kind of it's different in that way. They may find support in a way that is less of a spotlight on them in a sense, and like they feel like they can really join in and feel like connected with people.
Mhm.
That connection piece I think is so wonderful, and I think
Right.
really adds value to Plume. Like I really think that's so awesome. I'm glad that the wellness resources exist. I'm glad that all of those non-clinical services exist. Although we do need support in mental health, obviously, with everything going on. I'm seeing my therapist.
Right.
Like,
Yes.
you know. So thank you for touching on that. And I really enjoyed hearing you talk about that. So community feedback pertaining to medical services and healthcare is so vital to maintain an authentic outreach to the people being served. You all have recognized this through the creation of support groups and the delivery of newsletters to the community, as well as implementing systems from feedback, as you've told me. So, how would you say feedback from the community involvement in the growth of the organization has been significant in shaping the direction of the growth of services?
Yeah, the feedback has been critical from the very beginning. A lot of the feedback I was taking in was just doing the work that I was doing before Plume. And as we
Mhm.
talked about before, understanding like what are those barriers? What are the pain points? Like, how can this care look different? How can it look better? So, I mean, a lot of that I was taking in, I was, of course, caring for patients, right? I was plugged into
Yeah.
my community, whether it be our LGBT community center in Denver. And so there was like a lot of places where I was taking that information in. But even before we started, my co-founder and I were doing like formal interviews with people. We're like, hey, yeah, we've taken in a lot of information. We probably have some biases. How can we test those? And so we just talked to a lot of people throughout the country through the networks that we had and got their input. And then after we've been doing it, we've just taken that practice and done it time and time again. And so on a regular basis, we're always asking like, okay, how are we doing? We want to know like, what is the satisfaction that our patients have with the services
Yeah.
we're providing. And inherent in those satisfaction surveys are, of course, like how can we do it differently? How can we do it better? What would improve your experience? So that's something
Mhm.
that's happening on an ongoing basis. But to your point, we also have a newsletter that goes out. We talk about the services that we have. And sometimes, even if it's a element of like asking, well, what are we not doing that you'd want to see? So those are like surveys
Yeah.
that we and then there's all of this, the little stuff that isn't maybe a formal survey, but it's happening all the time. Our clinicians talking to patients, understanding their care needs.
Mhm.
Our care coordinators who are texting back and forth with patients
Mhm.
all the time. They're just taking in so much information, which is useful. And then just keep, talking to other people in the gender affirming care space. And so whether it's folks like yourselves, people working in clinics, anybody who's remotely related to this area of just what are you seeing? What feels big right now, what feels important. And so that's where a lot
Mhm.
of my job is just like talking to people and understanding what they're trying to solve for and how we can all collectively do this care.
Of course, right? That cycle of feedback is really vital to maintaining like the direction of where things are going. And I love how there's multiple ways of doing that. It makes it easy for people to say, oh, I can provide feedback here or I can provide feedback there. That's great. So, yeah, thank you for that. And I wanted to go into a little bit, if you can, about how the current state of our country is impacting gender affirming care, and to the extent that you can, how it's impacted Plume. So, in the midst of the recent federal onslaught on the provision of care and
Mhm.
rights for trans people across the country, many feelings have arisen, such as uncertainty, doubt, or mistrust between the people and the government, between people and healthcare. These
Mhm.
effects have trickled down to the healthcare environment, including such that gender affirming care is being stopped in some areas. I know that at my institution, Northwestern Medicine, they're not providing care at the moment for youth, individuals who are 18 or younger. So, keeping in
Mhm.
mind that Plume provides services for people 18 and over,
Right.
do you have any comments on the impact that the organization has experienced? Or if you can discuss how has the company responded to support its service users?
Yeah, for sure. We've definitely seen the impact, absolutely through the years. And I
Mm-hmm.
always like to break it down on a state level and a federal level. And yes, the
Sure.
federal stuff is, all happening now, and there's a lot to unpack there. But even before that happened, we've seen the last 2 years, now 3 years running, with over 600 bills put out on an annual basis that are anti-trans in nature. And a lot of those are
Wow.
impacting healthcare. And we've seen impacts of Plume directly at the state level, most notably with Florida's SB 254, right? And that
Mm,
was one that, on one level, prevented nurse practitioners and physician assistants from providing any gender affirming care to any patient, including adults,
mm,
and also required an in-person consent. And so we've had to adjust our model so that we can do that, and we're still providing care in Florida. Other states have attempted that, but fortunately, either they were reversed or did not go through. And so Missouri and
okay.
Ohio were notable examples of that, that either the AG made a change or they had legislation or a bill that could have changed that. So that's where most of the energy has gone. And so our response to that, of course, is, well, if we need to change our care model to adjust to the requirements, that's one way we've responded so that
Mm-hmm.
people can still get the care. But also through a lot of the advocacy that I was talking about, I think we try to use our platform so that when these moments come up, when these bills are introduced, one, we can make sure it's known to the community what they are, what they could do, and also what folks can do to take action. And so we partner with a lot of advocacy partners like A4TE, Advocates for Trans
Mm-hmm.
Equality, HRC, Lambda Legal, ACTU. There's a lot of other ones out there as well. And so to really try to provide resources to the public, and so that they can also take a stand, comment, whatever it
Yes.
might be. So that's where
Mm-hmm.
a lot of work has been done to this point. But we've also, as I said, been involved in public comment ourselves as an organization and as individuals in the organization. And now you look
Yeah.
at the federal level, where, of course, you have these broader sweeping changes with the executive orders, and everybody's waiting to see what's going to happen with these. And of course, there's a
Yeah.
lot of legal battles occurring to fight them, which is amazing, and so much gratitude to those legal champions on the ground who are doing this work tirelessly all the time.
Yeah,
Um,
certainly.
but with those that have come through, because we do care for folks who are 18 plus, and we don't take any federal funding of any sort, right? So we're not enrolled in Medicaid or Medicare at this point.
Okay.
That was ideally the plan, but it's been stalled out for the moment. And so we wouldn't be impacted by that executive order. We can provide that care. So nothing has changed on the federal
Good.
level for the work
Yeah.
that we do, which is good, but there's still impact, right? And as you said, like, it creates so much fear and anxiety. So we're seeing that a lot with our patients, who are the things that they're saying in visits, that they're messaging in. And then that, by definition, is going to impact our care team who's responding to all those
Mm-hmm.
questions, right? And they're trying to provide information, and we're moving into spaces where there actually, a lot of times, is no information to be given, right? There's
Yeah.
no answers. We're moving into these gray spaces, especially with a lot of what we've seen with executive orders coming out about passports, right? And in these
Yeah.
rules, there's just stuff happening all the time that is certainly unconstitutional and illegal, and very vaguely written in terms of what it actually means. And so trying to sort through all that, provide that education to patients, and then the care that we
Mm-hmm.
can, to support them depending on where the law is landing, and then that reverberates through the organization. So, I mean, a lot of the work we've been doing recently is like, yes, we want to make sure that our care teams have support in terms of information where we can, but also like
Mm-hmm.
emotional support as well. And we've been doing a lot of critical thinking as an organization. How do we support each other in this? How do we do, because we want to do
Yeah.
this for a while. This isn't anything new. I think any kind of social justice movement involves burnout. That is the
Mhm.
reality. It's hard work and it's emotionally impactful. And so I think really trying to think through, like, how do we do this for the long haul? How do we make this sustainable? And that we all have the support we need, no matter where we're working in the organization. Yeah.
Exactly. Thank you for breaking down the federal and state. Yeah. Thank you for explaining that, because there are effects that are at the state level, right? And that have
Yeah.
limitations. But then I guess federally, that's a separate point. And I'm actually glad to hear that at this point, those executive actions haven't had a direct impact, it sounds like, on the organization or the care that can be provided. And so I really do hope that in general, with the coming lawsuits and the actions that we see that have been taken, that we do see some overturning of those executive orders. We do see change that is beneficial and in favor of untrans lives. And personally, like, I've, felt those impacts, and it's really hard. But I also think, like, with the gender affirming care services that people receive, I think if that can be a constant for some people who are receiving services at Plume, and that doesn't change, I think that that can be like such a great source of support. And like we said, gender affirming care beyond hormones. So the opportunity to still interact with those wellness resources, still have
Right.
conversations, and get community in that way can be super beneficial in alleviating those feelings of being afraid or having uncertainty and or doubt.
Mm-hmm. Yeah, absolutely.
Yeah, I am almost to my last question,
Yeah.
but I've really enjoyed how you've discussed the organization and then your passions and everything. So, in the future, what improvements do you hope to see regarding improving the gender affirming care landscape in the next 5 to 10 years?
Great big question. I think about that one a lot. I think there's a lot of things. I mean, one, I'll just start by saying there's a lot of amazing work that's being done, right? And we talk about the legislative pressures. Those are really unfortunate and really challenging people in health systems right now. But
Mhm.
there's a lot of people doing amazing work, and it has evolved a lot, even over the past 5 years since we started, and certainly in the last 10, 15, 20 years, right? So the landscape is dramatically different. There's a lot more providers doing this care. There's a lot more providers who are interested in wanting to learn. And there's so much more both cultural competence and clinical competence. With that being said, there's
Mhm.
always work to be done, right? And maybe even because now more than ever, because those legislative pressures we're facing, it could start to peel back or roll back, the opinions of some people and comfort. There's always going to be the stalwarts who are just like going to do it no matter what.
Yeah.
Maybe those folks who might get a little hesitant because of all the legal stuff surrounding it. And so I do think about access, right? I always think about how can we create more access to care. And so that's, of course, something that we're trying to work on all the time. There's also the quality of care. I think, at the end of the day, every clinician, every healthcare provider wants to improve the life of their patients, as we said at the top of the call, right?
Yes.
Uh, and so for us at Plume, one thing we really want to keep working on, doubling down on, is concretely measuring outcomes. And I'll say care outcomes, because I don't even want to keep it specifically clinical. That's part of it. Yes, we want to know how folks are doing with things like their depression, their anxiety, but we also want to look
Mhm.
outside the box of just core clinical outcomes of, like, what does their quality of life look like? What does
Mhm.
their experience look like? Is that evolving in a positive way? How are they doing in terms of social determinants of health? Are they moving from
Exactly.
unemployed to employed? Are they moving from unhoused to housed? Are they improving things financially in a way that is congruent with their goals? There's a lot of work to be done there. And one of the things that we're working on is, like, having the data infrastructure to support that. And so we've made some pretty big strides in the last year, especially. So that's going to be something we're going to be looking for. And the goal we're setting for ourselves is we want the health outcomes, the broad care outcomes,
Mhm.
our patients, really the trans community at large, to be better than or equal to the general population, right? And now we
Yeah.
know we're starting on the back foot because we're disproportionately impacted by a lot of things. So it's a
Mhm.
it's a bold goal, and hopefully we'll go well beyond that.
Mhm.
But that's one goal we're setting for ourselves, and I think the system broadly is working towards that. We're seeing more
Mhm.
innovative research all the time. Now we just talked about the legislative landscape. We know that
Mhm.
research is being impacted, right, in academic centers, and so a lot to be determined there. So I think that the second piece I'll identify is just really doubling down on improving the care outcomes of our patients. And the third thing I'll say is just like highlighting not only the visibility, but the joy of trans people, right?
Yeah.
Just humanizing the experience. And there's always, there's a lot of course, anti-trans legislation and messaging out there. All seen that, and it's discouraging. But I think the more we can just show that, hey, like we, of course, are people like everybody else, and we're your neighbors, we're your siblings, we're your kids, etc., and just all here trying to thrive. And so we got some exciting things coming out on that level too, of really just kind of like portraying trans people in a way that maybe isn't always the portrayal when we see it in like headlines and that kind of thing.
Mm-hmm. That last point really sticks out to me about trans joy.
Yeah.
In a time where we have so much going on in the news, again, that is making people feel all of these have these scary moments, thinking about when do we have time to actually uplift people and celebrate, right? Like anyone who's stepping into Plume and starting affirming their gender, or starting their journey towards becoming a more authentic person, towards finding themselves, I think that's something to celebrate. And so that part really sticks out to me from what you said. And I do think that in the landscape of gender affirming care, I really do hope that we can have more space for that and help people who are coming into this space and like finding themselves actually feel that they can be happy about who they are, that they don't need to feel scared about what the world is saying as much. That's really like the context of the care, I suppose. And then obviously with the care outcomes as well, like what you said, not just thinking about the actual services, but then again, what's shaping like their access to care and improving that. So in my head, what you've talked about is really the mission of this podcast. It's all about uplifting those organizations, uplifting those people, and highlighting the efforts to serve communities that have historically been affected by health disparities. And being in the LGBTQI community, like, is going to be a goal and should be at the forefront of anyone around this field. And so I really do appreciate everything that you're doing. And it inspires me because I want to push towards that as well. And I just want to see where everything goes. And I'm so excited for what the future holds for Plume and what you end up doing, Dr. Kirkley. So thank you so much for being on the podcast. That was my last question.
Well, thank you, Renee. And thank you for doing the work that you do. Thank you for having these conversations, highlighting these important issues and bringing attention to it. I've so much appreciation for you. And I'm excited to see what you do as well. And I'm excited to see where medical school takes you. Yeah. So thank you.
Of course. Of course. I'll tell you a little bit more about like when I graduate and stuff after this, but I'm going to end the recording now. A key takeaway from my conversation with Dr. Kirkley lies in embracing the expansiveness of gender affirming care across multiple groups. For some people, it simply means being affirmed in their correct pronouns during a medical visit. For others, it means having access to therapy to discuss one's transition, seeing a hormone dispensing provider, and having part in a community with people of a similar background. I really value Dr. Kirkley's perspective as a trans woman herself. I feel super inspired going into this field after having this conversation. But we need more providers who are allies and/or from the community to stand with us, especially through this difficult time in the US and across the world, where our rights and humanity are consistently under threat. No LGBT person should be scared entering a doctor's appointment. Changing this starts with being affirming and supportive of the community up front. Plume Health is doing just that. Thank you for listening in. If you would like to visit the Plume Health website, visit getplume.co. You can find references for our conversation in this episode's biography. And if you want to hear more content, watch clips of our conversation, or keep up with the show, let's push the conversation more on Instagram at Equity Podcast or on TikTok at BEQPod. Full video podcast episodes are posted on YouTube, which is also linked in bio. Or you can type the Equity Podcast in the search bar. If you liked what you heard today, please give the show a quick star rating, follow, and/or subscribe on your preferred listening platform. Take care and see you in the next episode.